the C-spine. You guys seen a lot of those?
Mm-hmm.
Yes.
Very, very common.
That's
It's
like
chest
bread and butter.
X-rays and abdomens. What's that?
You should have done it first.
Do this first?
Second.
No, she's saying we should have heard this first because we do it so commonly in the hospital.
Oh, yeah.
I think we should do spine earlier in the semester.
No. And I understand that. Chest and abdomens is another type of procedure that you see commonly, but to get you guys familiar with the equipment, if we tested you on this first, you would vomit.
I think you did a great job.
Yeah, so we do the gradual thing and learning the
Good
basics.
job, Erica.
And so when you learn the basic exams of the extremities, it also gets you familiar with the, the movement of the equipment. So it's a perfect balance. So that is what we used to do before. We used to do the chest and abdomen first, and cervical spine was, the spinal column was one of those that we showed you guys first, but there was the connection from here to here didn't happen, and a lot of our students struggled through the comps. So we did it this way. Okay. Yeah, so this is common, just like a lot of chest. I mean, the patients that you get, they're not like your walkie-talkie types. They're usually coming through the ER.
Mm-hmm.
For what, this?
Yeah,
That's
outpatient. You get
outpatient.
an accident, cervical spine.
We get a lot in outpatient
Yeah.
though.
Fall out of the bike, cervical spine.
Yeah.
Cut your finger, cervical spine.
And chest X-ray.
Yeah, and chest X-ray.
Alex, will it do it?
Yeah, this is a very, very common type of procedure. So everybody has had a chance to see or do a C-spine? How about see? Everybody see one?
Yeah.
Yeah, how about do one? Okay. All right.
I tried.
You tried?
I tried. Yeah. There's more.
As long as you're trying. Okay. So the function of the vertebral column, it provides a flexible supporting column for the trunk and the head, transmits weight of the trunk and upper body to the lower limbs. It protects the spinal cord, serves as an articulation of the bony thorax and the muscles. Yeah, okay. All right. The vertebral column is broken up into 5 divisions, so we'll just talk just a little background on the vertebral column, and then we'll specifically discuss the cervical spine. So the vertebral column, 5 divisions. You have the cervical vertebrae, a total of 7, thoracic vertebrae, a total of 12, and there's 12, and it also relates to the 12 ribs. You have the lumbar vertebrae, which is a total of 5. We have 2 sets of numbers here when you're looking at the sacrum and the coccyx. So, as a child, the sacrum, 5 separate bones, and then eventually fuses into one. And then the coccyx, 4 separate bones, and then it fuses into one bone. So, in children, there's a total of 33 vertebrae, and then when you become an adult, there's a total of 26. Okay? The spinal cord begins at the medulla oblongata, and it tapers off at the level of approximately L1. In that area of L1, where it tapers off and spreads into the little, we call it horsehairs, that's known as the conus medullaris. All right, any questions? 2 basic curvatures of the spinal column. You have a concave curve, which is a curve that is inward, and you have a convex curve, which is a curve outwards. When you are born with 2 curves. These are your primary curves, and they are convex in nature. Okay, so these are your primary curves when you're born. The compensatory curves, you have 1 and 2. They don't develop until the child starts to hold their head up. This is where the first compensatory curve comes about. Okay, and this type of curve is concave, so it curves inward. The second compensatory curve develops when the child begins to walk. Okay, so you have 2 primaries and you have 2 compensatories. Lordosis is a term for extreme concavity. Kyphosis is a condition where you have extreme convexity. So if you have an exaggerated convex curve, this is known as kyphosis. Call that a humpback. And then if you have an exaggerated concavity, then it's called a swayback or lordosis. And then we have the side curve, lateral curve. So not all of us, most of us don't have a straight back. There is going to be a slight lateral curve to our back. It's only because we favor one or the other, and that's due to carrying heavy objects. So normally we do have a scoliotic curve. That's the lateral curve. If it's extreme, greater than 10-degree angulation, we'll talk about this later on, but if you have a greater than 10-degree angulation laterally, it is considered scoliosis. But most of us have less than a 10-degree angulation, and that's normal. How many of you guys have done scoliosis studies? Okay. You do one shot or two separate shots? One shot? Okay. Now, where you guys do when you do your scoliosis studies, do you have breastplates to protect the breasts? Okay.
No.
No? Yes? Okay.
And one yes, one no.
Okay. All right. So let's talk about the basic anatomy of the vertebrae. Going from cervical to thoracic to lumbar, there are going to be some slight nuances, but this is the typical vertebrae. So beginning with the anterior portion, okay, this is the anterior. You have the body, so that's the most anterior, the body. From the body, you have two projections, okay, one on each side. You have a pedicle on each side. So this is what projects from the body. From the pedicle, it goes laterally. That is your transverse process. So here we have the transverse process. And then they come back again to join towards the middle. That is the lamina. And you have two laminae, one on each side. And then the laminae join to form the spinous process. The two pedicles and the two laminae forms the vertebral arch. And this is what's going to encase the spinal canal. So the opening down the middle is the vertebral foramen, or the vertebral canal. The processes is where you have muscle attachment. Any questions so far? Okay. Then let's keep on going. So this is typical vertebrae.
Processes.
The processes, right here. I just switched slides. All right. Then we have our articulating processes. You have a superior, which is on the top. You have an inferior, which is on the bottom. And when you stack the vertebrae on top of another, you have the superior of one articulating with the inferior of the other. Okay, you guys with me so far? So you have the superior articulating process of one vertebrae and the inferior articulating process of the other vertebrae. And when you stack them up, that joint is known as the, and I want to make sure I get this right because they keep changing the term, is zygapophyseal joint. Zygapophyseal joint. It used to be called zygapophyseal. That's why I said I want to get the terminology correct. Okay, so superior and inferior articulating processes forms the zygapophyseal joints. One thing that I added on here that you don't have on your slides, and that's why I changed it, I have a different color here, is the pars inticularis. Pars inticularis. And that is the segment between the superior and inferior articulating processes. It is the segment right here. Right here. So it is part of the lamina. This is part of the lamina, but that particular section is known as the pars inticularis. And this is significant when in such conditions known as ankylosing spondylosis, where this area fractures or breaks off and causes the vertebral body to move forward. Okay, it's a breaking off of this area right here, the pars. Okay, any questions so far on this particular slide? Okay, so any questions on the pars? So it is part of the lamina.
What's it called when it breaks?
It's called ankylosing spondylosis, spondylolisthesis. We'll get to that. Yeah, it's a tongue twister. All right, so again, the articulation between your superior and inferior articulating processes forms the zygapophyseal joints. There's also a couple areas here where you have a little notch or a dip that occurs right off the body. These are called your vertebral notches. You do have a superior and you do have an inferior vertebral notch. And when you stack the two vertebrae, again, it forms a circular pattern, which is a foramen, and that forms the intervertebral foramina. I don't know if I have a picture here of that. So, inferior notch, superior notch of the other, it forms this foramen. This is known as the intervertebral foramina. And this allows passage for spinal nerves and blood vessels. Okay, so those are formed by the notches, inferior and superior. Okay, we good? In between the bodies, between the bodies of the vertebrae, there is a padding. This padding is known as the intervertebral discs. The most outer portion of it is the annulus fibrosa, which is very thick, very fibrous. It's the annulus. And right in the middle of it is a more, they call it a semi-gelatinous type of consistency. And this is the nucleus pulposa, right in the middle. The nucleus pulposa. Now there is a condition where the nucleus ruptures right through the annulus. Okay, there's a common term for that. What do we call that? Herniated disc. Okay, so when this pulposa herniates through the annulus, it's going to impinge or press up against the spinal cord and cause a lot of pain. Lower back pain may cause some numbing, but that's your herniated disc. Okay. The purpose of the disc, again, it acts as a cushion between the vertebrae, acts as a shock absorber, and it does provide flexibility. So here we have a MRI sagittal study of the spinal column. So when we're looking at this, which region what are we looking at here? What region?
Spinal cord.
Okay, which are we talking about? Cervical, lumbar, thoracic? What are we talking about?
Cervical.
Cervical, okay? As you can see the brain right here, spinal cord. So we're looking at the spinal cord, and you can see that here the nucleus is protruding through the annulus and impinging up against the spinal cord. So that can, again, can cause some pain, can cause some numbness. Depending on the severity, they may not do anything about it. And here's one of the lumbosacral region. All right, so let's go ahead and begin the anatomy of the cervical spine. So how many cervical spines are there?
7.
A total of 7. The first 2 is non-typical. So we're going to cover the non-typical vertebrae of the cervical spine first, and then we'll talk about the rest of the typical cervical vertebrae. So the very first one here is C1, also known as the atlas. The atlas is what supports your head. Okay? So in comparison to the typical vertebrae, there's a lot of parts that are missing. For one thing, it doesn't have a body. Okay? So in place of the body, we have the anterior arch with the anterior tubercle. Anterior arch with an anterior tubercle, a bone that protrudes. Okay? And on the back side of it, instead of a spinous process, we have a posterior arch. A posterior arch with a posterior tubercle. Just like the typical vertebrae, it does have a transverse process. There's something unique about this process in that it contains an opening. Transverse foramina. Okay, so it contains the transverse foramina. On the very top of C1, you have a smooth surface on either side, smooth surface on the other side, and this are the facets where your skull sits on top of, forming the atlanto-occipital
Joint.
joint. You said joint. Good job. I was going to say articulation, but joint's easier to say. Okay. And there's also a labeling here of the transverse atlantal ligament. This right here. This is what holds C1 and C2 together. So that ligament holds C1 and C2 together. And then you have the sectional view of the dens or the odontoid. Are you guys all familiar with the odontoid?
You?
Okay, the odontoid. Not the view, but the odontoid is part of the bone. So this is a cross-section of it. This is not part of C1. The odontoid is part of
C2.
C2. So they're just showing C1 as it projects, C2 as it projects up to C1. Okay? All right, any questions here? The lateral mass I'm going to talk about here in just a moment, but the lateral mass is a very thick bone, part of the cervical vertebrae. It's very thick, very dense. And the whole purpose of this lateral mass is that it helps support the weight of the head. Okay, so this is probably going to be one of the thickest, most densest part of the vertebrae. The cervical vertebrae is the lateral mass.
So the thickest?
It's going to be the thickest, most dense part of the cervical vertebrae because it has to support the head. All right. No questions here? Keep on going. All right. C2. So in C2, in place of the body, okay, we now do have a body, but in place of that, now we have a piece of bone that projects superiorly. This is known as the odontoid or the dens. The odontoid or the dens. right off of the ends of the body are your articulating processes. Okay, superior articulating process, and this articulates with the inferior articulating process of what?
C1.
C1. So this is where C1 is going to sit on top of, right here. Then you have your transverse process, your transverse foramen. So again, you have the openings here that allows the passage of your vertebral arteries and veins and nerves. So these are the arteries that feed your brain. That goes through here. Now it's starting to look more like a typical vertebrae because we have a lamina. If you look at the first one here, C1, there is no lamina. So here's your lamina, right off the transverse, on your typical. We don't have it here, it's just an arch. When you look here, now you have the lamina, or two laminae. And then the laminae join in the center, in the posterior, to form the spinous process. Okay? You don't have it in C1, you have it in C2. Okay? Any questions? So the articulation between your superior and inferior articulating processes, again, this is your zygapophyseal joints. Here we have the lateral mass of C1. Remember, we said it was a very dense, very bony part of the cervical vertebrae that helps support the weight of the head. Okay. Any questions here? All right. So when you stack up this cervical vertebrae, the dense part of the bones, again, this is your lateral masses, and when you stack them up, this forms your articular pillar. So your articular pillars are formed by the lateral masses, which is part of it's between your superior and inferior articulating surfaces. They're very thick, very dense, and I put down here, I don't think this was in your slides, but it's a bulky, solid portion of the cervical spine that supports weight of the head and also assists in the rotation of the head. Okay, any questions? Chris, you doing okay? Okay. All right. Can I continue, or are you guys still writing stuff? Yes, no? Yes, continue, okay. All right, so now let's go ahead and talk about the rest of the typical vertebrae. This is going to be from 3 to 7. Okay, 3 to 7. So you have the body. Off the body, you have the transverse process. Okay, the transverse process then come back with the laminae, and they join up in the center to form the spinous process. Now, what's very unique about the cervical vertebrae? 3 characteristics. Okay. First characteristic is that it has a bifid tip. Bifid tip you would find in C2 to C6. C2 to C6. Then you have the lateral masses that forms the articular pillars. And unique also about the cervical vertebrae, you have 3 openings. You have 2 transverse foramina, and then one in the middle is your vertebral foramen, and what goes through there?
Spinal cord.
Spinal cord. Okay. Okay. All right. What do we? Okay. So zygapophyseal. Okay. So zygapophyseal joint. What forms that?
The superior and inferior articular.
Superior and inferior
Articular.
articulating processes. Okay. All right. So you have your intervertebral foramens. What forms the intervertebral foramens?
The
This is about
superior,
4 or 5 slides back.
superior and
It's going to
notches.
be your superior
And
and
inferior.
inferior notches, which forms the opening. And this is indicative. You need to understand this because the way the foramens are set up, you can only see this in a 45-degree obliquity of the patient. Okay, so to evaluate those foraminas, help me out with my English. Foramens?
Oh.
Foraminas? Okay. To evaluate the foraminas, inferior, superior notches, okay, we need to turn the patient in a 45-degree angulation to visualize this. Also, what we need to keep in mind when we're doing an oblique to visualize the foraminas or foramens, we're also going to do a 15-degree cephalad angle, because the way the cervical bodies stack up, to open up that foramina nice, is we need to have a 15-degree angulation. Now, this is very specific because it says 15-degree cephalad angle. This only applies to posterior obliques. Posterior obliques. Okay, posterior obliques. If I were to do an anterior oblique, okay, which way are we going to angle our X-ray tube?
Cotted.
We're going to go the opposite way. Okay, so this applies to posterior oblique, 15-degree cephalad angle. So that's to demonstrate the intervertebral foramen. And then when you look at the alignment of the articulating surfaces, it's in a true lateral. So to visualize the joint space between your upper vertebral and the lower vertebral, the zygapophyseal joints, we're going to place our patient in a true lateral position. Are we good? So to demonstrate your zygapophyseal joints again, to visualize the joint between your inferior and superior articulating processes, the patient is going to be in a true lateral position. Okay. And to demonstrate the intervertebral foramina, look how nice these are. It's nice openings. Formed by the inferior notch of one vertebrae and the superior notch of another. You're going to place the patient in a 45-degree obliquity. Okay, 45-degree obliquity. With a 5-degree angulation towards the head, but again, this applies with a posterior oblique. Okay. 15-degree angulation towards the head. This applies to a posterior oblique. Also make note that when the patient is a posterior oblique, we are looking at the intervertebral foramina that's furthest away from the image receptor. We're looking at the intervertebral foramina that is furthest away from the image receptor. So if I'm in an LPO, okay, am I looking at the left or the right intervertebral foraminas?
Right.
The right side, okay? With that said, if I did an anterior oblique,
Side down.
RAO, if I'm RAO, am I looking at my right or the left side?
Right.
The right side, okay, good. Okay, got it? what do we call this?
Odontoids.
Odontoid, open mouth. Okay. So the open mouth. The open mouth, which we'll talk about later on, the open mouth is to visualize C2, but also we're looking at the articulation between C1 and C2. Okay, see the joint space right here? We're looking at this, and we're also trying to visualize the odontoid. We're not going to see between 2 and 3. This is specifically for C1 and C2 and also the dents or the odontoid. All right, so in looking at the anatomy over here, what's this?
Teeth.
That's your teeth. Yeah. So you have upper teeth, you have lower teeth. The whole purpose of opening up your mouth is to try to get the teeth out of the way to visualize the structures. Okay? So this, if you properly align your incisor, bottom of your incisors with the back of your skull, if you have proper alignment, you should see this without any type of superimposition of the other structures. So this is your teeth. A.
Dents.
Okay, your dents. And we've got this thick portion right
Lateral
here.
masses.
Lateral mass of
C1.
C1, and this would be the
T2.
lateral mass of C2. Okay. What is this joint called?
Zygopophyseal joint.
Zygopophyseal joint. Okay. What is the surface called here?
Inferior articulating surface.
Everybody see that? Inferior articulating, and this is going to be
Superior.
superior articulating, which forms the zygopophyseal joint. Okay. Not quite sure what B is pointing to. The jaw.
Transverse process of C1.
It just says it on the slide.
Yeah.
We're like we're
transverse
smart.
process of C1. Okay.
I'm just that good.
We're just that good.
I thought you were that good, Nick.
Well, I am,
I was like,
but-
damn, Nick.
You didn't realize it was on the slide.
All right. What is this right here?
That's a spinous process.
Spinous process of
C2.
C2. Okay, that's not. You may want to label that. Okay, so point to this. This is the spinous process of C2.
You can. I am that good.
I know you are. I believe it.
All right. So a brief summary on how to demonstrate the different structures. So for the cervical spine, when we're looking at the intervertebral foramina, it's going to be